cancer diagnosis teaches you how much strength you have as an individual and what you really can push through and overcome so that you can continue to lead a life and live the life that you were put on this earth to live. My name is Kimberly Wilson. I was diagnosed with stage 4 esophageal cancer in April of 2022. The first symptom that I noticed was I was having difficulty swallowing, particularly pizza crust, sandwiches, steaks, and then I was also experiencing an increase in hiccups that didn't make sense. At that point, I knew it was time to go see a doctor. I saw my primary care physician who referred me for an endoscopy and a referral to the gastroenterologist. During that time of waiting for the appointments, I did notice that my symptoms increased in frequency and severity. Even taking a sip of water would cause me to hiccup. It started to impact my daily life conversations and just some of my daily activities because of the symptoms that I was experiencing. The results of the endoscopy did come back rather quickly, actually in less than 24 hours, and those results confirmed that I did have esophageal cancer. Right after the diagnosis, it was really a whirlwind, but at the same time, I felt very reassured because I could tell very quickly there's a great deal of coordination that was happening behind the scenes by the staff of MedStar. I was not burdened with tasks of calling and making appointments. They were reaching out to me, they were coordinating appointment times, and they were making sure that I knew exactly where to be, who I was going to be seeing, and what I could expect during those visits. The 3 doctors who I worked with very quickly and very closely right away the day after my diagnosis were Dr. Ziv Gamliel, my thoracic surgeon, Dr. Kevin Chen, my oncologist, and then Dr. Stephen Ronson, my radiological oncologist. It was very evident from the time that I met each of those doctors that they were skilled in their practice. They were educated in latest technologies as well as treatment options. They took the time to explain options, they drew diagrams for me, and they really answered all the questions that I had and my family had. Dr. Gamliel told me during my first visit that the doctors would be the drivers of my treatment plan, but I could press the brake or the gas at any point in time based on my comfort level and what I wanted to get out of my treatment plan. Esophageal cancer is a cancer that requires very fast action. You're encouraged to get second opinions, but at the same time, there's decisions that need to be made. I quickly was informed that I had 2 lymph nodes that needed to be removed surgically. They were removed. And then right after that, I started a combination of chemo and radiation for 6 weeks. I was given a little bit of a break to recover from the radiation and chemo before proceeding with a full 12.5-hour McCohen esophagectomy. About 2 weeks post-surgery, I did have some scans that showed clear margins. And then I began immunotherapy in September. When I went for my 3-month post-surgical scans in November, that is when there was a recurrence that was noted in the lymph nodes in my neck and clavicle. After receiving that news and having just returned to work a week prior, it was very overwhelming. It was frustrating, but we stayed focused on what we needed to do in order to get me back to a place where I could say that the cancer was under control and not continuing to spread in throughout my body. After that reoccurrence, I did continue immunotherapy, and then my doctors prescribed that I begin a new chemo regimen that was on a cycle of every 2 weeks. I went into the clinic for 6 hours on a Monday for chemo, and then I wore a pump home for 2 days before going back and getting disconnected from at the clinic. And then I would have 11 days to recover before I began the next cycle of treatment, and that went on for 2 years. After the first couple cycles, I did have some additional scans occurring every 3 months, and in spring of 2023, my imaging did reveal that there was no radiological evidence of disease in my body any longer. It was a great relief for myself and my family. It renewed our hope. It brought some life back in me, even though I was not feeling great from the drugs, and I knew I just needed to push through and complete the regimen. Since then, all of my 3-month checks of scans have all revealed no evidence of radiological disease. My doctors have declared that my cancer is asleep. I see myself as being a thriver. I am a stage 4 esophageal cancer patient, but I thrive and move through life and continue to live life every day. We spend a lot of time on the baseball field with my oldest son. My youngest son, I spend a lot of time, concerts and live music, and travel. My husband and I, even if it's just traveling for the day or traveling for the week, we're okay with just jumping in the truck and sleeping in the back of the truck to make a trip halfway across the country to experience something that we've not experienced before. Another huge part of what I'm doing and that I focus on is advocacy related to esophageal cancer. I have spent days on Capitol Hill. I've spent time before the Food and Drug Administration testifying about my experience with treatment options. I have served as a patient advocate, and I work very hard to create awareness surrounding the disease and provide assistance where I can to those who are faced with the disease. If my doctors were sitting here today, I would say, thank you. Thank you for saving my life.